So in this video, I'd like to cover a few suggestions about tips and tricks that I like, or tools I use when it comes to my condition, systemic sclerosis. And I also want to cover an update about what's been going on since my second rheumatology visit. So let's start with that first. So what happened is my doctor put me on a medication called mycophenolate mofetil, and I believe that's a generic for CellCept, and I'll show you how big the bottle is. It's pretty big. Now when you get that prescription, you should be getting a document that has a lot of information about it, that covers side effects and I guess how to use the medication, what it is, and other considerations. You should definitely read through the entire thing, because some of these there's quite a few possible side effects, and some that can be a little severe, so you need to make sure you read through the document. The other thing I want to say is when I did my hall walk, I ended up getting a sensor put on like this. It's oxygen sensor, and depending on the individual, sometimes when you put these sensors on, and I've had this happen in the doctor's office, sometimes they'll give you a read and it'll be quick, as you can see, or you'll get this screen, it'll be like that for a while. So let's see what happens. I got a quick one right there. So be aware that if you have this condition, you're trying to use this and you're not seeing a reading for a while, that might be what it is. I've actually had that happen in the doctor's office. When I went for my hall walk, it actually worked, and then when I started exercising, about 2 to 3 minutes into the test, I could not get a good reading. It looked like it dropped to 70%. So at that time, they stopped the test, and they ended up giving me a monitor wear on my forehead, and I continued to proceed with the test. So just be aware of that. If you have this condition, that might happen. You might have an issue with that oxygen sensor. Oh, right. Another thing I want to cover is I ended up being part of a study at my doctor's office. So depending on where you're going for treatment, let's assume you're going to an academic center that does research, or a place that is most likely going to be an academic center or academic hospital, you may be offered studies if you have this condition. Now, I was offered a few studies right at the beginning, and you had to make a determination about what you're comfortable with and what you aren't. Don't feel pressured to do a study that you're not comfortable with. So the one study I did, it was about 5 pages long. And in that study, it was my first test of doing the study. I had to contact another doctor. I got a small payment for it, and I had the thought that the results would go into my medical chart, and the only thing I saw when the study was done was it stated that it was done for the process of research, and I got nothing. I was really surprised by that, so be aware of that. The only thing that may have been another benefit of that study was that there'd be a second set of eyes looking at the report, so if they found something that was odd, they were obligated to tell my doctor, and I'd be aware of something they would have caught. This is a copy of a study that I did not take a part of, and this is 12 pages long. So the longer it is, the more likely you're probably going to have something where you guys sign off on multiple things. And if you're comfortable with it, great. If you're not, don't sign it. It's up to you. All right, so let me move on to some of the suggestions I have for people who are living this condition. I am early in this disease, and so these are the things I've found. It's not a complete list, but I'll just let you know what I feel is helpful, and I'll start with gloves. So these are CVS Health brand durable oatmeal nitrile exam gloves. Now these are supposedly soothe and smooth skin. There are some gloves I have tried that I itch a lot with them, So this has been a really good fit for me. It also has textured fingers for better grip. If you have this condition, your fingers might be slick. It might be something where you drop stuff. This has been a really good item for me. I did try some Target ones, and I didn't like those because it was hard for me to get my hands in them. As you can see, they're swollen. These fit me very well. It says one size fits most. They come 42 a box, and I pay, right now I pay about $12 to $13 for them, so that's an option. If you want something to drink, you need to consider the container you're going to use. So this is a tumbler I got from Starbucks, and I went and I tried several of their tumblers. Some of them were not, well, most of the ones I was looking at I didn't feel were very easy for me to open, but this one, which was on clearance, is great. As you can see, I can turn it, take it back off, has a flip open top, and you can close. This one was the easiest for me to open from the ones I've tried. So if you're looking for a tumbler, I suggest you maybe look at Starbucks, try out their options, and see if you can find something that's a good fit for you. The next thing I want to cover is, and this is going to be pretty obvious, but scissors. You're going to need a set of scissors. So when it comes to opening bags and such, you're going to find that it's a little more difficult, either because of the way your fingers are slick, or you don't really have the ability to open it. Something that would be really normal for someone else to do, like just open up a bag of chips or something, might be a lot harder for you to do. So you definitely need a good pair of scissors. When it comes to writing, I like this pin. Now, depending on the person, you may have a difficult time pulling off cap pins. I did. So I've switched over to a pin that has a push top. And this has a rubber bottom here, so it's a little easier for me to grip so it doesn't slip. And this is called Bic Atlantis. Let me move on to something else here. We have this little cup here, and I'm not sure who it's made by, but they're fairly cheap. You get 4 to a pack. And if you are taking showers, you may find that you have difficulty opening up the flip top on like a shampoo bottle, a conditioner bottle, a body wash bottle. And I personally had to ask someone to help me open those bottles up. I love this because it allows me to pour in whatever I need into there, and it's very easy to open. This is textured right here, so it's nice to grip. You can just close it off. Now you don't have to close it all the way, but there you go. And it's big, so it's easy for me to hold on to. I think that costs no more than about $4 to $5 on that. It's fairly cheap for the set. Another thing you'll want to consider is sanitizer, something to take with you. So, of course, this is a spray one, but you can use, a gel, whatever you like. Just make sure you have one of these with you so that you can keep yourself safe on the go. Let's assume you can't use gloves for whatever reason. This is another option to have. The next thing I'll cover is Band-Aids, because people with this condition can get ulcers. They can get them on the fingertips, they can get them on the hand, just depends. So make sure you're stocked with Band-Aids and you keep on top of your wound care. The next thing I want to cover will be lotion. Right, so I got a bottle right here. You're going to want a lot of lotion. Sometimes, let's just make sure you get a good quality brand, but that may not prevent you from scratching even after you apply it. It'll help soothe the skin, but you may have an issue scratching. So this is a bottle of Eucerin, but I will tell you that although it soothes the skin, there have been times I've scratched past it. And then here comes a box of shoes that I like. These are Bob's from Skechers. They're memory foam. I feel these are very comfortable. They're easy to put on. As you can see, I don't know if you can see a picture. So as you can see, they're sneakers right there. I like these because I feel they're easy to put on. They're soft and they're very comfortable. I love these shoes. Okay, I think that's about it for today.